I'm Savannah Granat, and this is my presentation on the awareness and misperceptions of hospice and palliative care, a population based survey study. For those of you that don't know the difference between hospice and palliative care, hospice occurs during the last 6 months of life with no curative treatment, and palliative care improves the quality of life by addressing patient needs with or without curative intent. The framework for this study was surveying community dwellers in New York over the age of 18 using a survey of 3 questions on hospice and palliative care and what people know about them. And after the survey results, researchers examined them and discussed the survey's limitations. Researchers wanted to know the awareness level, misconceptions, and receptiveness of hospice and palliative care, what people know about both or what they think they know. Researchers are aware that the services are underutilized because of both patient and caregivers or families' lack of understanding and common misperceptions, and the stress of the situation often adds to the underutilization of both services. For this experiment, researchers used a cross sectional study that they paid to have added to the Empire State Poll, which is a poll that is given to people in New York City over the age of 18. The purpose of the poll is to collect participant demographics like age, gender, race, education, marital status, religion, and household income. And the participants are randomly chosen based on their phone numbers, landlines, and cell phones. The survey included 3 different questions. The first question they asked was, how would you define hospice care? They wanted to know how people defined hospice care in their own words and what they knew about it. In the second question, it started with palliative care is a type of medical care that is gaining in popularity, followed with the question, how would you define palliative care? They wanted to know if people knew there was a difference between hospice and palliative care, or if people even knew that palliative care existed. And then for the third question, after being read a definition of palliative care, they were asked, would you recommend palliative care services to a loved one? After receiving the results, researchers compared the answers of the varying demographics in the survey. In the results, participants were overall more aware of hospice than palliative care, but knew palliative care was comfort care after being read that definition. As you can see in the hospice chart, many people knew that end of life care was hospice. On the palliative care chart, very few people knew that. The mean age for the survey was 47 years old, a majority of people being white, married, they had some college education or higher, and a reported household income of $50,000 or greater. Misconceptions highly contributed to results, with some participants even comparing hospice to euthanasia. When comparing demographics, lower receptivity to palliative care was associated with being a conservative male with a lower household income and lower palliative care awareness. Findings follow what researchers already knew. There are many misperceptions about hospice and palliative care due to lack of knowledge and misinformation. The real-world implications for this study are that resources exist like Before I Die or Redesigning Death, both which are global organizations that bring awareness to end-of-life care. Among patients admitted to the hospital, less than 5% are seen by a palliative care team, and less than half of individuals who die in the United States receive hospice. So my question to you are you aware of how hospice and palliative care can be utilized? And have you ever had an experience with either, and how would you describe that experience?